Let's talk about something that's probably happened to you if you've ever used a home blood pressure monitor. You measure one arm, then the other, and the numbers are different. So what gives? Is your machine on the fritz? Are you doing something wrong? Or is your body trying to tell you something? Well, we're going to figure it out.
Yeah, I bet this scene looks pretty familiar. You take a reading on your left arm, then you switch to the right, and the numbers just don't match up. It's a super common thing, honestly. And it can leave you wondering, okay, which one of these is my real blood pressure? And maybe even, should I be worried? So let's clear up that confusion right now.
All right, so first things first, let's tackle the biggest question head on. Is it normal to have a difference between your arms, or is it some kind of red flag? Let's break it all down. And here is the good news right off the bat. For most people, most of the time, having a small difference in the readings between your arms is completely, totally normal. It's incredibly common, so you can take a nice deep breath. But why does it even happen in the first place? Well, the reasons usually fall into one of two big buckets. On one side, you've got your normal physiology, just the way your body is put together. And on the other side, you have simple measurement errors, which are all about how you're taking the reading. Let's start with the body stuff because it's pretty fascinating. It's funny. We might look pretty symmetrical on the outside, but our internal plumbing, not so much. Your aorta, that's the main highway for blood leaving your heart, sends a branch directly to your left arm. But for your right arm, the path is a little more scenic. The blood has to take a slightly different route. And that tiny difference in the journey is often enough to create a small, totally natural variation in pressure. So what kind of difference are we really talking about here? Well, because of that unique body blueprint, a variation of about 5 to 10 points, that's millimeters of mercury or mmHg, is generally considered no big deal. It's just normal. But a lot of the time, the difference has nothing to do with your arteries at all. It's all about simple and totally fixable mistakes. Like if the cuff is a little tighter on one arm, or maybe one of your arms is resting just a bit higher than the other, bam, you'll get different readings. Even not waiting a minute or two between measurements can throw the numbers off. These little things can easily create a 10-point difference all by themselves. Okay, so we've established that a small difference is usually fine, but what about when that gap gets bigger? Well, sometimes it can actually be a pretty important heads up from your body. And this is really the key. We're not talking about a one-time weird reading here. We're talking about a consistent difference, one that you see over and over again. When that starts happening, it might just be your body's way of pointing to an issue with your vascular health. Think of it like a garden hose. If there's a little kink or a partial blockage somewhere along the hose, the water pressure is going to be lower past that point, right? It's the same idea with your arteries. If one is getting a bit stiff or has some plaque buildup, the blood pressure on that side will be consistently lower. It's a classic sign doctors look for, especially as we get older. So what's the number? What's the threshold that makes doctors and nurses really sit up and pay attention? Generally, it's a consistent difference of 15 points or more. Once you hit that mark, it shifts from being just a normal variation to something that really does need a closer look. Now, before anyone panics, I want to be really clear here. These conditions are not common, but a large and persistent difference could be an early clue for things like a narrowing of the main artery that feeds the arm, or even other more serious issues. And that's exactly why tracking this difference is so valuable. It can be an early warning system. All right, so we've covered the why behind all this. Now let's get to the most practical, useful part. What should you actually do with this information? Let's build your action plan. The official guidelines basically give us a really simple cheat sheet. Think of it like a traffic light. If the difference is 10 points or less, green light, you're in the normal range. Between 10 and 15, that's a yellow light. It's worth keeping an eye on. And if you're consistently seeing a difference of 15, 20 or more, that's a red light, a clear signal it's time to get it checked out. Of course, all of this depends on getting good, accurate numbers in the first place. The proper way to do it is actually pretty simple. The very first time you check, measure both arms. Take a couple of readings on each one to be sure. Whichever arm consistently gives you the higher number, that's your new go-to arm. From now on, you'll always use that one. That way you and your doctor never accidentally underestimate your true blood pressure. So when is it really time to pick up the phone? Here's your checklist. 1. If that difference between your arms is consistently 15 points or higher. 2. If you have that difference and other symptoms like feeling dizzy, some chest tightness, or maybe one arm just feels tired or weak. And 3. If you already have a history of high blood pressure or heart disease, it's always best to play it safe and just chat with your doctor about any new patterns you see. Whew, we have covered a lot, from basic anatomy to a full-on action plan. So let's bring it all home and focus on the one single idea that you should absolutely walk away with. Seriously, if you only remember one thing, make it this. Don't sweat the small, occasional differences in your blood pressure readings. That's just your body being your body. Do, however, pay attention to a large and persistent gap between your arms. Think of it as a quiet little message from your body, and it's one that is definitely worth listening to. At the end of the day, understanding this little detail about blood pressure is really part of a much bigger idea, learning how to listen to all the subtle signals our bodies send us. So the question I want to leave you with is this. Now that you know about this one, what's the next signal from your body you're going to notice? Thanks for tuning in.